Abdominal x-rays are used to evaluate soft tissues of the abdomen, such as kidney, bladder, liver, intestines. Once I have placed the patient's information into the computer and selected what type of x-ray I will be taking, I will measure the patient at the highest point, usually around the 13th rib. When using an abdominal x-ray to assess the liver, you should use this lateral view. If you are assessing a vomiting patient, you should use the left lateral view. When taking abdominal x-rays, it can sometimes be suggested that the patient be fasted for 12 hours before or a 3 to 4 hour prior to x-ray enema, or even emptying the bladder. If available, you could use sandbags to hold the forelimbs crenally and hold the hind limbs caudally, while keeping the head in a natural position with a sandbag possibly over the neck. I will select my KVP and MAS based on my measurement and my technique chart. The collimation should start just below the full diaphragm and go all the way to the coxofemoral joint. The x-ray should be taken at full expiration, and the marker should be placed at the ventral aspect of the abdomen. After inputting all the patient's information into the computer and selecting ventral dorsal abdomen, I will then measure the patient at the caudal aspect of the 13th rib, about level of the umbilicus. A trough may be needed, but the patient should be placed in dorsal recumbency with its head gently pulled forward. The forelimbs should also be extended forward with a sandbag if possible, and the hind limbs should be kept in a natural position, also with a sandbag over each limb. In this case, we did not have sandbags to hold the hind limbs in natural position, so my assistant pulled the hind limbs caudally. It may be a good idea to use a trough when taking a VD x-ray to ensure that there is a straight line connecting the point of the nose to the caudal midline. The marker can be placed on either side of the abdomen, as long as it's in view. VD x-rays should also be taken at full expiration to ensure that the diaphragm is positioned crenally and is not compressing the abdominal contents.